My name is Corinne Gentry, and I'm here to talk to you about CHD, or Canine Hip Dysplasia. What is CHD? It is a chronic skeletal condition observed in canines, which is characterized by the abnormal formation, laxity, degeneration, or osteoarthritis of the joint, the cox femoral, in the hip. Some dogs are born with CHD. Because of their genetics, it is considered a polygenetic trait, while some dogs can develop this because of their nutrition during early development, causing the puppy to grow at a rapid rate, or other multifactorial developmental disorders. Did you know that larger breeds like German Shepherds, Golden Retrievers, Labradors, St. Bernards, and Rottweilers are more susceptible to having the hip dysplasia because they grow at such a large, rapid rate when they're puppies? I just gave you two examples here just to kind of show you what we mean by hip dysplasia. I will go into further explanation further down. I just wanted you to be able to see here that this is what a normal hip looks like. This is with mild hip dysplasia. We start to see that the femoral head changes shape slightly and that it is kind of moving away from that nice pocket. And this is severe hip dysplasia. You will see that we have arthritis here. That femoral head is completely changed shape at this point, and it is lax away from that pocket that we like. CHD is typically considered to be a chronic condition, as it develops gradually over time due to genetic predisposition, environmental factors, or a combination of both. Signs of hip dysplasia may become evident as a dog grows and ages, with symptoms worsening over time. The hip joint, which is a primary focus of this condition, is located in the junction of the hind limb in the pelvis. It's proximal to the pelvis and distal to the knee joint. Hip dysplasia can significantly affect the normal range of motion and functionality of the hip joint, impacting various movements such as adduction, abduction, flexation, and extension. In hip dysplasia, the malformation of the hip can lead to increased laxity and instability. This can result in excessive adduction, causing the affected limb to move inward or more than usual. Over this time, abnormal movement may contribute to further damage and degeneration of the joint structures. Abduction. In hip dysplasia, the instability and abnormal morphology to the joint may restrict abnormal abduction. Dogs with hip dysplasia may reduce the ability to spread their hind limbs apart, resulting in limitations in movement and potentially affecting their gait and overall mobility. For flexation in hip dysplasia, it's comprised of joint structures and associated pain may limit the range of flexation in the affected hip joint. Dogs may exhibit reluctance to flex the hip joint fully, leading to stiffness and discomfort, particularly during activities such as rising from a laying position or climbing stairs. Extension. When it comes to hip dysplasia, it can also impair normal ranges of extension in the hip joint. Dogs with hip dysplasia may find difficulty in fully extending their hind legs, as well as resulting in a shortened stride length and altering the movement pattern to compensate for the reduced range of motion. Some symptoms of hip dysplasia, as you can see here in the photo that I have used, you will see that animals will have certain things that they're telling us, like the decrease in activity, an increase in maybe the shoulder muscle mass because they're using less of the back limbs, so they're having to compensate. You may also notice a loss of that thigh muscle mass. It is important to discuss hip dysplasia because it is prevalent along certain breeds, but is a potential for causing much chronic pain as well as impaired mobility, and then the impact of their overall quality of life. While not immediately life-threatening, but untreated hip dysplasia can cause severe pain, lameness, and secondary osteoarthritis. Clinical signs of hip dysplasia may vary, but you may see things like difficulty rising, reluctance to exercise, lameness, hind limb weakness, as well as the characteristic bunny hopping gait. Affected dogs may also not display signs of discomfort, or may, depending on how the hip joint when it gets manipulated. Inflammation changes may occur secondary to hip dysplasia, particularly in response to the joint degeneration as well as instability. Signs of this inflammation may include swelling, warmth, and pain upon palpation in affected hip joint. In severe cases, intramuscular hematomas may develop, causing localized swelling and discomfort. For diagnostics, there are various tests that we can use to diagnose hip dysplasia, but many of the most common are sedated radiographs and/or CT. It is recommended for sedation just because it could be painful for your pet, as well as it allows us to position those hips in the correct way. Usually it is in a VD, that, as you will see here in both of my radiographs, you can see that the pelvis line is equal as well as the hips are equal. That allows us to have a good view of that hip socket joint that we love, so we can see how far the hip dysplasia has basically evolved. Further down, I have some citations for all the information that I've gathered today. I hope this has been educational for you and you learn how severe this can be painfully for your pet. And if you need any more other information, just let me know and we can get a treatment plan started for you as well. Thank you.